It's being hailed as a medical breakthrough, a test that can predict who's going to get Alzheimer's disease.
It boasts an incredible accuracy rate, but it's not without controversy. CBS 2's Dr. Max Gomez shows us how it works.
A simple blood test may be able to predict who will get Alzheimer's disease several years before symptoms develop. Researchers at Georgetown University Medical Center followed 525 apparently mentally healthy seniors for several years. Some went on to develop mental impairment. The researchers then went back to see if there was something in their blood that could have predicted the dementia.
There was a small number of circulating blood fats, lipids, which were able to predict at the time of entry, when cognitively normal, those individuals who would go on to become cognitively impaired.
Those blood markers are very different from the conventional markers that have been used in previous tests. And although the blood test was able to estimate with more than 90% accuracy which people would develop mild cognitive impairment or Alzheimer's disease within 3 years, it would also generate a lot of false positive results, far more than the FDA normally allows for screening tests. Still, the developer says the test is valuable.
Being able to ask the question, does an intervention or a therapy work to delay progression?
Several members of Cappy Friedman's family have had Alzheimer's disease. The 84-year-old took part in the study, but participants were not told the results. She says she would want to have the test if it were available.
I think it's very important to get people involved in this, particularly where there's a family history.
In any case, the availability of this test is years away. The question remains whether people want to know they might develop Alzheimer's if there's little they can do to hold it off at this point. That ability is still in the future. And false positives, being told you'll develop Alzheimer's when you actually won't, is clearly a huge drawback to this test. Christine?
All right, thanks, Max, very much. Well,